Good morning, USRNs. Today we will discuss about respiratory disorders. Under respiratory disorders, we have gas exchange. We have diseases or illnesses like COPD, chronic obstructive pulmonary disease, emphysema, bronchitis, Cox disease. Also, the other name of it is tuberculosis. We will also talk about asthma and acute respiratory failure. Alright, before we go to the diseases and illnesses under respiratory disorders, we will talk about gas exchange first. Paano ba nangyayari yung gas exchange sa katawan natin? So we have the very first gas that we need is carbon dioxide. Yes, carbon dioxide. Carbon dioxide goes to brain. The brain has a central chemoreceptor which goes to the phrenic nerve and then goes to diaphragm, and then we exhale carbon dioxide. Now, because of the absence of carbon dioxide, the body needs clean air. The source of clean air is oxygen. Now we will undergo inhalation of oxygen and goes back to carbon dioxide. Again, the process of gas exchange from CO2 goes to the brain, goes to central chemoreceptor, and then to the phrenic nerve, to the diaphragm, and then will undergo CO2 exhalation. And then the absence of CO2 requires us to get clean air, and the source of clean air is oxygen, and we are undergoing the process of inhalation, and it goes back to the first step, to the very first cycle. Alright, after we know the process of gas exchange into our body, we will talk about some diseases and illnesses under respiratory system. Kapag merong mga sakit dito and illnesses na hindi nabanggit, I will probably create another videos that will include those diseases and illnesses. So the first one that we will talk about is COPD, which stands for chronic obstructive pulmonary disease. If it's chronic, it should be more than 6 months. The number one cause of COPD is smoking. People who are at risk for having COPD are those people working in a cement company, people who are exposed to radon gas, people who's inhaling a lot of air pollution, even a car mechanic worker could also be at risk for COPD, asbestos exposure, and the list goes on and on. No? Diagnosis: if you will diagnose a patient having COPD, the nursing diagnosis would be ineffective airway clearance. Again, ineffective airway clearance. There are two types of COPD: chronic bronchitis and emphysema. Chronic bronchitis, the common cause is smoking, while emphysema, the common cause is, guess what? Chronic bronchitis. We have management for COPD. COPD management is also COPD. High caloric diet. So we need to give our patient foods high in protein, high in fat, or moderate in fat, low carbohydrates. Why do we need to give low carbohydrates? Because carbohydrates end product is carbon dioxide. Okay. Now we also need to give oxygen to the patient, which is a low flow oxygen that's going to be 2 to 3 liters of oxygen. This is the first priority. The first priority is oxygenation because of the hypoxic drive. You will also see a person having COPD having a pursed lip breathing for a patient with emphysema. So kapag nakikita mo yung pursed lip breathing, it means that the patient is possibly having emphysema. So P is to P. The drug of choice is bronchodilators. Kasi nga may problema sa airway clearance, we need to give patient bronchodilators to dilate the bronchos, obviously. Example of bronchodilators, we have beta agonist. Example, sympathomimetics, methylxanthines, for example, theophylline, leukotriene modifiers. We can also give anticholinergic. We can give corticosteroid to the patient and mast cell stabilizers. The next one that we will talk about is the emphysema. Emphysema is the second type of COPD. This is the end stage of COPD. It means to say that there is a damage of the alveoli structure that will lead to decreased elastase that will cause distended alveoli. And there are two manifestations, or the effect of a distended alveoli would be towards the lungs, which is an overinflated lungs, and also patient will experience difficulty in breathing. Okay, if the lungs are overinflated, you will see manifestation to patient, which is barrel chest. In pedia, it's called pigeon chest. And again, patient will have difficulty in breathing. This is due to the carbon dioxide being trapped or carbon dioxide accumulation. And afterwards, it results to vasodilation to attract oxygen. So the effect of it is to vasodilate to attract oxygen. So after which, patient will experience flushing of skin, or what we call the pink puffers. Again, emphysema is an end-stage progression of COPD. There is a damage of alveoli structure that decrease elastase that will lead to distended alveoli that will overinflate the lungs and will make patient having trouble in breathing or difficulty breathing due to carbon dioxide being trapped. If the lungs are overinflated, the patient will have barrel chest for adults, and for pedia, it's pigeon chest. Now, vasodilation takes place, and that will lead to flushing of skin, and that will cause pink puffers. Alrighty, now we will move to the other type of COPD, which is bronchitis. It's from the word bronchioles, no? It's an inflammation. So bronchitis, this is a bronchi inflammation. Paano ba tayo nakakakuha ng inflammation of our bronchi? So it undergoes an inflammation process wherein the goblet cells are activated. The goblet cells increase mucose production. That will lead, or that will cause, a cyanotic appearance to the patient, or what we call the blue bloaters. Di ba kapag cyanotic ka, parang you will turn into blue color. So always remember, cyanotic appearance. The other term for that is blue bloaters. Why? Because oxygen can no longer enter due to mucose plugging. Ang effect naman nito sa fingers would be clubbing. So clubbing of fingers because oxygen can no longer enter. And of course, patient will have difficulty breathing because oxygen can no longer enter. This also leads to orthopnea because oxygen can no longer enter. Orthopnea, ito yung condition wherein patient would like lean forward in order for them to like breathe normally. They are comfortable breathing in an orthoptic position, gasping out of air. And in order for them to like breathe normally, they would do orthoptic breathing. So again, there is an inflammation process that results to goblet cells activation, and then the goblet cells increases mucose production that will lead patient to cyanotic appearance or blue bloaters, clubbing of fingers, difficulty in breathing, and orthopnea. Those are the signs of bronchitis. The number one cause of bronchitis is smoking. Okay, side notes, goblet cells. Goblet cells is responsible for mucose production in the lungs. Now we move on to Koch's disease. Si Koch's disease, sa third world country, TB. Sa first world country, Koch's disease. This is known to be caused by Mycobacterium tuberculei or Mycobacterium bovis. Sa mga hayop, yung bovis. Baka. Sa baka. Okay, so this is bacterial because it's from Mycobacterium. The known signs of fever, common signs are, the known signs of Koch's disease includes fever, night sweats, anorexia. B symptoms if 3 are not present. B symptoms if 3 are not present. Outcome naman, the early signs is mucopurulent or phlegm. Parang Bavarian colored phlegm. Yun yung early signs. Pero kapag late signs na, it includes hemoptysis or vomiting of blood, coughing out of blood, and weight loss. So, Koch's patient should be in an airborne precaution. The use of N95 and HEPA mask is a must for airborne precaution. Patient should be in a private room with negative pressure. Client's diagnostic test is Mantoux test or PPD. Mantoux test or PPD. Help to diagnose positive result via Row-N genogram or X-ray. To check for Ghon's complex. When we check Ghon's complex, we need to check for the lesions or white infiltration on the apical area, which is the upper area of the lungs. A, apical area, A for above. Healthcare provider will suspect you being positive if the result is positive. The other diagnostic test would be the sputum exam or the acid-fast bacilli. The drugs that we can give to our patient with Koch's disease are the following. We have the mnemonics RIPES, rifampicin, isoniazid, pyrazinamide, ethambutol, streptomycin. Again, we have rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin. Rifampicin, the side effects of which is that it'll turn your urine into red-orange in color, and also your sweat will turn into red-orange in color. Isoniazid is a prophylactic drug. Vitamin B6, pyridoxine for nerve health should be administered with it. It will decrease the peripheral neuropathy or numbness or tingling sensation of the fingers. Yan po yung functioning vitamin B complex. See, pyrazinamide, the side effect of which is that there will be an increase in uric acid that will lead to gouty arthritis. Ethambutol, the side effect of it is that it could damage cranial nerve number 2. And see, streptomycin, this is an ototoxic, and nephrotoxic, it'll damage the kidneys. Now we proceed to asthma. Very common to see asthma nowadays. It's because almost all of the kids or newborns being born from their moms are through CS delivery. And when a mom is delivering via cesarean section delivery, there will be a use of anesthesia. No? So, ano ang nangyayari dito kay asthma? There is a constriction of bronchioles. There is a constriction of bronchioles that will lead to difficulty of breathing to patient. Other causes of asthma would be reactions to allergens. That would be the immediate cause. It could also lead to, the other causes would be intrinsic or extrinsic. Intrinsic, we have flu, common colds, URTI. Extrinsic from outside factors like dust, pollens, FAR, sprays like from the perfumes, fumes, smoking, chocolate, changes in climate, and nuts. Manifestation is bronchoconstriction. Number 1 manifestation of asthma is bronchoconstriction. Signs and symptoms would be shortness of breath, wheezing. Kay wheezing is under asthma. Wheezing is under asthma. Nasal flaring, use of cranial nerve number 11, which is the accessory muscle. Patient tends to be very restless. This is the first sign of apprehension. And the skin is cold to touch, cold clammy skin. Acid-base balance is the other manifestation of asthma. For early sign, there is hyperventilation. That will lead to respiratory alkalosis. That will lead to positive wheezing asthma sound. Late stage naman, we have negative wheezing. Walang wheezing, it means that there is hypoventilation. What happens during hypoventilation? There is a carbon dioxide retention that will lead to respiratory acidosis. So si acid-base balance dito kay asthma, kapag early stage, respiratory alkalosis because of hyperventilation. Hyper, nasa taas, so early stage. Hypo, nasa baba, so late stage. Hypoventilation is respiratory acidosis kasi nga hypoventilation. Management of care for patients with asthma. Number 1 is airway. You need to establish airway. During an acute asthma attack, we can give epinephrine to patient. During acute attack of asthma, we can give epinephrine. The route of epinephrine is subcutaneous into 3 doses, but you still have to bring patient to the nearest emergency room. Epinephrine is a rapid-acting bronchodilator. Epinephrine has a short-acting effect. During sa latent phase, the drugs that we could use are theophylline and aminophylline. Theophylline and aminophylline. Itong drugs na to, it has a long-acting bronchodilators. It will give sympathetic effect to the sympathetic nervous system. So remember sa discussion natin about SNS, when it comes to respiration, it'll increase. When it comes to heart rate, it'll also increase. When it comes to blood pressure, it'll also increase, as well as the temperature and palpitation. We can also give out corticosteroid via inhalation to this patient. So, merong sample scenario dyan. If bronchodilators and steroid inhalation are given at the same time, the first one that you have to give is the bronchodilators. After bronchodilators, pwede mo na ibigay si steroids. Tandaan lang yung steps na yan. Anyways, alphabetical naman siya. Bronchodilators first, and then you give steroids. BS. Okay? Number 2, management of care for patient with asthma is gonna be breathing promotion or to promote breathing. This is needed for lung expansion. So, ano yung best choice of position to promote lung expansion? It would be the orthopnic position. It could also be the seating position. It could be the high Fowler's or upright position, high backrest position, and neutral position. Letter B, deep breathing exercise. The patient needs that. Patient also needs chest physiotherapy after nebulization and to increase fluid intake to liquefy secretion. Of course, give oxygen to the patient and promote rest. What are the complications of asthma? Complications of asthma, if plan of care is not working within 24 hours, it will lead to status asthmaticus. So after 24 hours, kapag hindi na-resolve si asthma, it will lead to status asthmaticus. Let's say, sa panliligaw, let's say na-in-love ka kay asthma, nanliligaw ka, tapos yung goal mo is dapat mapasagot mo siya after 24 hours. So after 24 hours na nililigawan mo si asthma, pwede mo nang tanungin si asthma, ano yung status natin, asthma? Asthmaticus, I care for you. Status asthmaticus. Management dyan is intubation set at bedside or mechanical ventilator. The diagnostic test that we could use to diagnose asthma would be peak flow meter. Ito yung may parang pipe na hinihipan mo to measure the force of expiratory volume. Meron yung tatlong colors para rin stoplight, red, yellow, and green. Kapag red lang yung inabot ni patient, 50% lang of FEV ang meron. Ito yung expiratory volume or something. So 50% lang, ibig sabihin nun, we need to report this to the doctor. Kapag yellow naman, yun yung nasa gitna. 50 to 79%. Kapag yellow yung indication ng peak flow meter, we need to give bronchodilators to the patient. However, if it's normal, it should be 80 to 100%, which is the normal ventilation. Okay, ang next naman nating pag-uusapan ay si acute respiratory failure. This is the terminal stage of all respiratory or lung disease. Ito yung cause of death. Acute respiratory failure is the terminal stage of all respiratory or lung disease. So, sa diagram, makikita nyo kapag less than 50 PaO2, ibig sabihin yan, patient would have hypoxemia. Kapag si PaCO2 naman is more than 50, ibig sabihin yan, patient is having hypercapnia. So again, less than 50, it's PaO2. More than 50, it's if less than 50 PaO2, it's hypoxemia. If it's more than 50 PaCO2, it's hypercapnia. But both could lead to acute respiratory failure. Management dyan is mechanical ventilator. Alright, so side notes tayo. Alright, si Mantoux test. This is given intradermal. 48 to 72 hours yung result. Yung purpose nito is to verify if there was a positive exposure to tuberculosis amongst patient. So we need to check for induration. If it's negative, the measurement would be 0 to 55 millimeter. If patient is immunocompromised, halimbawa si patient meron siyang HIV, chemotherapy, treatment, post-organ transplant, basta anything that will lead to immunity compromission, kung compromise si patient, the measurement would be 6 to 10 millimeter. If it's more than 10 millimeter, that's absolute positive TB exposure. So, si TB, yung part ng lungs, sa taas ng lungs, that's the apical side. The apical part or apical site. Yung sa baba naman is si basal site. So, si air nasa apical site. A for air, A for apical. B, basal, B for baba, nasa baba. Okay, remember that we have talked about AFB or the acid-fast bacilli or sputum exam. Meron siyang ruling. There should be 2 out of 3 positive results. So for example, first result niya is negative, kailangan natin ng second exam. Kung sa second exam niya is positive, kailangan pa natin ng panibagong exam kasi we need another positive result. So let's say sa pangatlo niya is positive. So ibig sabihin nun may dalawa ng positive. So positive si patient for AFB. On TB drugs, do a liver function test every 6 months and do renal checkup as well. Remember, if you're having some TB drugs, do liver function test every 6 months and do renal checkup as well. Okay. Reaction to allergens is immediate. Goblet cells, siya yung responsible for mucus production in the lungs. Phrenic nerve, this is responsible for activation of our diaphragm. Diaphragm in between the intestine in the lungs. This is a muscle, main muscle of respiration. Elastase, structure 2 of alveoli. Lung recoil helps expel CO2. Surfactant for babies because babies has no lung recoil. Alveoli, where gas exchange happens, CO2 and product of carbohydrates. Hypoxic drive helps the lungs when it's not functioning well. Requires oxygen and should be 89 to 92%. If it's more than 92%, hypoxic drive will shut off. Patient will not breathe anymore. Okay, COPD, the oxygen level should be 2 to 3 liters only. Always remember, kapag COPD patient, when administering oxygen, it should only be 2 to 3 liters. If patient is given 4 liters of oxygen, patient will have hypoxic drive. Okay, thank you for listening, USRNs. Good luck.